ago, I moved into a house that was so massively roach infested that they would fall from the ceiling and sometimes even fall on me. But the family I was living with kept the rooms so dark that most of the time we didn't really see the roaches. I bombed the whole place with tons of roach bombs and killed all of them, I thought. But eventually those that survived grew back, grew out of control, and we couldn't kill them with roach bombs anymore. Similarly, conventional chemotherapy seems to eradicate a tumor. And then, maybe months or years later, it goes out of control and kills the patient. This matters to us all because we will all become or come to know a cancer patient. And that's because more than 1 in 3 adult Americans will be diagnosed with cancer during their lifetime. Through my reading, I've learned about adaptive therapy. It's a new chemotherapy strategy that discourages drug-resistant cancer, allowing patients to live longer. Let's first consider why so few of those roaches that I bombed survived. Those that survived did so because they instinctively kept deep within crevices. That's a good strategy. It's a good way for a roach to live in a brightly lit room like most people have most of the time. But in the always dark apartment I was living in, we didn't see them and we didn't kill them. So those that stayed hidden missed out on most of the food and water. Those that roamed freely and were aggressive got all the food and water and outcompeted them, keeping the shy ones a low population. Of course, once I bombed out all the ones running around, those in the crevices are the ones that repopulated, and they had the right instincts to survive the bombs. So, blasting an infestation or an infection or even cancer with everything you've got is often not the right idea. It helps the drug-resistant organisms by killing off their competition. So nevertheless, though, conventional chemotherapy uses the maximum tolerated dose of chemotherapy drugs. It's basically just short of killing the person. You've got the ones that would be killed growing freely and rapidly, not defending themselves, and there's just a couple that might be able to survive. Then you zap them with, you keep this chemotherapy going at maximum dose, seem to get rid of the cancer, but eventually it grows back out of control and you can't kill it off with the chemotherapy. Dr. Robert Gatenby realized that in these situations, it might be better to treat cancer as a chronic disease, like diabetes. And instead of trying to kill as many cancer cells as possible, just kill as few as necessary. This new therapy is called adaptive therapy. It uses smaller intermittent drug doses. So instead of holding down this constant chemotherapy, you just do a smaller dose, kill off most of the ones that are resistant, but keep some alive so you can compete against the resistant ones, and only give it more when there's some growth. Then you can repeat the cycle. It grows, you zap it, grows, you zap it. So that's the theory. Dr. Gatenby, before he could actually do a trial with people, he had been for many years modeling these with game theory and actually equations used to model competition between species. So it's treated like evolution. And using those math models, he tested on mouse. Mouse works. So he eventually in 2014 got a pilot trial going with 18 men who were suffering from incurable prostate cancer. According to published results from before this, and according to people being treated outside of the study, the tumors were growing uncontrollably after 13 months on average with people like this. But those using adaptive therapy, as of August 2019, they were 34 months on average before growing uncontrollably. And they only used 40% as much of the drug. And since there's no FDA approval needed and these results were so good, some oncologists already started using it in their practice. Actually, more than half of the patients are still being treated, so the average could go up to 34 months. in summary, adaptive therapy is new chemotherapy treatment that extends lives, and it makes, while conventional therapy unwittingly encourages the uncontrolled growth of drug-resistant cancer cells, adaptive therapy uses smaller, intermittent drug doses to allow the drug-sensitive cells to survive and compete for resources. Doctors are free to use adaptive therapy in their practice right away because it doesn't use any new drugs. It just changes the dose, which is not under FDA control. Thank you.